there are families that are having to choose between, should I pick up my insulin with this copay, or should I be able to buy this little extra bit for food?
We've told you about the skyrocketing cost of insulin for years. The life-saving drug diabetics need to survive. A vial that might cost the manufacturers a few dollars to make can cost the patient hundreds of dollars out of pocket. But now the governor calls it a game changer, and one Louisville man calls it a step in the right direction. Bashir signed a bill to cap out-of-pocket insulin costs at $30 for a 30-day supply. Here's more on the bill and some input from a type 1 diabetic in our community.
30 million Americans are grappling with diabetes. Whether it's type 1, where they lack insulin, which we need to live, or you have type 2, when your body can't use what it has. And of all the people struggling with that reality, 1 in 4 have had to ration their insulin because of the out-of-pocket costs.
So after I meet my deductible, I usually pay $100 to $120 a month because I take 2 different kinds of insulin.
The cap applies to people with state-regulated healthcare plans or plans purchased on the Marketplace exchange, state employees, and people under group plans. 1 in 10 Kentuckians doesn't have health insurance, and for diabetics without it, insulin can cost hundreds of dollars a month.
Hundreds of thousands of people in our Commonwealth that have no health insurance today, and thousands of diabetics in Kentucky don't have health insurance. So they're still having to pay thousands of dollars a year for their insulin. And the sad part is, if you can't afford health insurance, then you can't afford your insulin.
Before heading to the governor, the bill received unanimous yes votes in both the House and the Senate. The bill also requires healthcare benefit plans to provide equipment, supplies, and training. For Traeger, it's progress, but opening up trade in the insulin industry is the next goal for the community.
It's a huge day for diabetics. There's a lot more work to do, but this is a great step.
In Indiana, Senator Ron Grooms co-authored a bill to relieve some of the financial burden on Hoosiers. A new law took effect at the beginning of the year for users of an older insulin to help ease the financial burden of the drug. The bill allows diabetics to get the cheaper, older types of insulin without a prescription in the state. The new law provides a critical safety net during emergency situations and gives access for those who cannot afford a doctor's visit to get a prescription.